one of the major challenges of Sturge-Weber is it's super rare. So understanding, what happens when you have diabetes or hypertension or a stroke is fairly straightforward because there's so many people that have it. Understanding Sturge-Weber is a big challenge. And this is why, our clinical care networks and the research that we do to create databases to understand what goes on, how it changes, what treatments work, what doesn't work, all these questions that, everybody who has the disease or family members who are caring for somebody who has the disease are on everybody's mind. And, when I came into this, I just said, when people would ask me what to do, I said, I have no idea. We just don't know enough yet. We need to collect data. We need to collect good data. So for those who don't know me, I am an adult neurologist. I am an epileptologist, do epilepsy surgeries, but also the head of the Department of Neurology at the University of Illinois in Chicago, and have been, studying human brain disorders my whole career. And fortunately, for the past, 5-10 years now, I have been thinking a lot about Sturge-Weber in terms of how it progresses and what we can really do to make a difference. And so I want to tell you about our NIH, National Institutes of Health supported grant called the Brain Vascular Malformation. And I'm going to share my screen, and if all works, you'll see my screen, and I'll go ahead and get started. So where we are, where we're going with Sturge-Weber, and let me just start out by mentioning, as many of you know, that this is not a simple disease because it occurs during embryonic development, can affect the face, the skin, the eye, and the brain from something called a somatic mutation. And so it can be variable, and it can have different symptoms and different treatments in different parts of the brain, the eye, and the skin. So we're very fortunate to have Matt Shirley as our Chief Scientific Officer, and he, together with his advisor at the time, Jonathan Pevsner, made the discovery of the gene mutation of Sturge-Weber syndrome. It's a gene called GNAQ. And this is now about 10 years old. And so, wow, we know the gene, and that's wonderful, but are we closer to curing the disease? Are we closer to understanding the clinical problems that we deal with on a day-to-day basis? I'm going to talk about that. So yeah, there's Matt, and you'll see him in person, I think, in a little bit to follow. Wonderful guy. But the other thing that's important to think about, that even though the abnormality, the genetic mutation occurs during the embryonic development, disease does not stop, and the brain disease continues to advance into adulthood. So the questions everybody should be asking is, what to expect as I grow older, as your son or daughter gets older? What can we do? Can we prevent the disease from getting worse? Can we do anything to improve quality of life? And really, again, this last question, what can we do? I mean, we know this is there. Can we stop it? Can we stop it in its tracks so that whatever damage is done, and you move forward with a normal life as you can? So this is, it's good to, since I'm a neurologist, I do focus more on the brain, but this is the same thing that we're seeing here is what you see on the skin and the eye. And this is an MRI of the brain. You can see somebody's eyes there. You can see the brain back here. And the white stuff you see, that's a contrast dye. So that's given in the blood, and you can see it's in the blood vessels. But what's unique here on this side of the brain, it's not just in the blood vessels. It tends to go up and down through these little crevices, or the sulci of the brain in this area where the Sturge-Weber lesion is. And that's the angioma. Angioma means a collection of blood vessels, and they're actually not in the brain. They're sitting on the surface of the brain. You can see it here on this section higher up in the brain, this white area on the surface of the brain. That's a collection of blood vessels. So the question is, what is this doing to the brain? The lesion does not seem to be in the brain, but it's in the blood vessels that surround the brain. Here's a picture through a microscope of a part of that brain that has been removed through surgery. The area on the surface of the brain is here. all those tiny little red dots, those are red blood cells like blood. They kind of look like blood in little blood vessels, those circles. And it shouldn't look like that. You shouldn't have this collection of blood vessels sitting on the surface of the brain. Now, when you're born, the brain looks fairly normal, but after the first few years of life, it becomes abnormal and you develop these little purple spicules sitting out through the brain substance itself. So the pink area here is the brain. This is outside the brain. These are the blood vessels sitting on the surface of the brain called leptomeningeal angiotetomatosis. These are calcifications. So everybody talks about there's calcification in the brain. If you do a CAT scan or an X-ray, you see these calcifications in the brain, and they form over time. And as they're forming, that's often when we start seeing symptoms get worse, more seizures, more headaches, more stroke-like episodes. So what is the interaction, or what's the interplay between what's going on the surface of the brain with the malformation? That's the birth defect there to the brain, and why is it causing these things, and can we stop this? This is a CAT scan. So a CAT scan is different than an MRI. It's like a plain X-ray. And here you can actually see the bone is white. So anything like, the bone is calcified. And you shouldn't have white inside the brain and this is showing the calcification inside the brain in the back of the brain. I don't know if you can also see the white areas here. That shouldn't be there. This is another way of looking at this with a special MRI. That sees calcification as black areas. So again, it shows these blood vessels as these little snake-like substances going through the brain. There's abnormal blood vessels on this side of the brain compared to this side, but you also see those blotches of calcification as the disease is progressing over time. That's the blood vessels. And here you can see in a child at 21 months of age, you don't see much of that black area here. But by 3 years and 13 years, that area gets much, much darker. So as it's getting darker, those calcifications are becoming larger and more dense. And calcium is actually fairly toxic for brain cells and maybe somehow has something to do with this. The other thought is it may actually just be, well, the brain has been damaged and what's left is calcification. So this is the summary, that there's a gene mutation that occurs during the embryo. It's not something that you inherit. It happens in one part of the embryo so that you get the abnormality on one side of the face, and often with a skin lesion on that same side, you have the brain abnormality or the vascular malformation on the brain on that same side. That changes over time, leading to cognitive problems, learning disabilities, seizures, headaches, migraines, and these very strange stroke-like episodes that are very unique to Sturge-Weber. And the problem is it progresses over time, even into adulthood. I see a lot of adults with Sturge-Weber. Some of them are fine, and then when they turn 60, 70 years old, all of a sudden they start getting symptoms again. So it can really change some of the symptoms over time. So we need to think about treatment at many different stages of life, from early on, way we could prevent this, to once it forms, to how do we treat the different symptoms. Sometimes the seizures and stroke-like episodes, which are very scary, get out of control, and how are we treating these? So we have existing medications that we as neurologists use, like seizure medications, migraine medications, but then there's other things to think about. What about aspirin? Is this something that should be given to children? There are downsides to taking aspirin. Should we be thinning the blood or not? What about the calcium? What if we treat the calcium with certain drugs that block calcium or chelate calcium? These are things we don't know, but they're ideas and things that we really could test. So what are these symptoms we're talking about? Sorry about that. My phone was making noises. I'm going to tell you about Maureen. And this is a common story that we hear a lot. My seizures, I get this tingling feeling on my right foot. It's slowly, over 10 minutes, it's a slow neurologic symptom, rises up my leg as a wave of tingling, and afterwards, my leg feels numb and weak. This feeling spreads to my arm, sometimes my hand and my face. Afterwards, I get so weak that I have trouble walking sometimes, but it often gets better over 30 minutes or so. I then sometimes get a pounding, throbbing headache and lasts all day. So this is an unusual symptom. It's somewhere between a migraine and a seizure or a stroke-like episode. We don't really understand these, but they're very common in patients with Sturge-Weber. So what's the problem? As I talked about before I started the PowerPoint, there's so much we don't know, and we really need to study people who have this disorder and collect really good quality data to understand how and when the disease progresses, and how does this link to what we see in the brain? Do we see this correlate with calcium? Do we see this correlate with other vascular changes? And we need to identify new treatments and get ready, because if we get some clues by looking at historical data of patients, maybe this will give us clues of clinical trials where we can systematically test a drug or a treatment. So one of our main goals in our projects is to become what's called clinical trial ready, so that we have identified patients who have the disease, who would qualify for a trial, what symptoms we would test, and what particular drugs that we want to use, so that we can either prevent symptoms or prevent, more importantly, the disease from progressing further. So a longstanding project that's supported by the government, the National Institutes of Health, is called the Brain Vascular Malformation Consortium. For about 12, 13 years, this project's been ongoing. And when I got involved a couple years ago, I said, listen, we're doing all these studies, but we still just don't know enough. And now is the days of big data. We need to collect everything we know about people with Sturge-Weber, create a really highly curated, well-vented database so that we can start to answer some of these questions to figure out what's going on, when things might be getting worse, and how to treat it. And our goal is to recruit 250 patients over 5 years. The goal is to see if we can see what's going on, clinical symptoms in terms of brain imaging, or something we can measure in the blood, so we could predict these neurological symptoms, and also to identify which of these treatments may or may not be working in patients historically. We want to link these clinical symptoms and treatments to what's going on in the brain. So we need pictures of the brain at different stages to see how this relates to what's going on clinically. And finally, as I mentioned, we need to say what would be the clinical trials or studies that we would do, and which patients would we choose for those studies if we had a particular treatment. And again, a major focus on stopping the disease from progressing further. So we have basically been enrolling patients. We have, I think, 9 sites right now, because we just brought on New Mexico. And working through the clinical care network, we are not limited to the sites around the country, because we can recruit patients from anywhere at this point. We have a centralized database that protects, the identity of the individuals. We keep everybody anonymous, but we also not only upload a lot of clinical information. Sometimes adults have been seen since they were babies, and we want to track these things over time. And I'll show you an example of what that might look like. But also get as many of their brain images as we can. If you had, 5 MRIs during their lifetime so far, I want all those MRIs, because that allows us to build this longitudinal understanding of what's happening in the brain while we're seeing what's happened to that person clinically. And then we bring it all together in a relational database and build a dashboard, so that hopefully not only we can use this for research, but maybe if we can use this for get better care of patients. It's very hard to go through medical records, particularly people who have chronic illnesses, and synthesize a story of what's been happening and what's worked and what's not. Medical records are actually pretty terrible, if any of you have seen your medical records. So these are our investigators and our sites. University of Illinois in Chicago is the main site where we build a lot of the software we're using. Doug Marchuk, who's the co-PI of the grant at Duke, is developing a plasma biomarker program. And Csaba Juhász, who many of you who know has been working on imaging with MRIs and Sturge-Weber for many years, is our lead for the imaging studies. And again, we have these other sites for collecting patients. So a big team, but for everybody, it's a chronic disease. It involves the face, the eye, and the skin. It takes a lot of work to pull all of this information together. And it's not just upon the researchers, it takes something from the families and the patients to collect this data, because we don't want to just get your recollection. We want to actually get the clinical notes that are accurate and dated and timed. So this is what the dashboard looks like. And wow, wouldn't it be nice to have this when you went to your next appointment? So here's your age. Here's when you had seizures in blue, when you've had headaches, and what the magnitude of those symptoms were, whether they're cognitive or behavioral problems, headaches, skin problems. All of that can be measured graphically, and you can hover over each of these dots and click on them, and it'll tell you what it was. You also want to know what treatments were done and when they were started and stopped. So we have a longitudinal dashboard of this medication, Tegretol. Strattera was given for hyperactivity. We want to know when these things were started and stopped. And when you do that, you can actually look up and down and say, did this work or did this not work? And if you do this with enough people with Sturge-Weber, you may actually get a clue as to what works and what doesn't. And to understand, as he said, what's called the pathophysiology, or what's happening in the brain, for this individual, we've collected MRIs at age 3, 13, 15, and 17. We have all these different types of images. You click on these, you can actually see the pictures, and we're developing really cool tools that you can actually build longitudinal movies. We just got a supplement to the grant for one of our engineers to build movies, so we can actually play the development of the brain and the lesions and see what happens over time and see it visually. One of the parts of the study we're also interested in is why all of a sudden do things get worse? What happens? So we're very interested, once you enroll in the study, if you do have a bout of seizures or stroke-like episodes, we want more data. We want to collect another blood sample at that point and see if we can find a biomarker to indicate what went wrong. What can we learn? Can we see something in the blood? Can we see something in the brain? So as I mentioned, this is our study. We're eager to recruit as many people as possible. Even if you're not in one of those cities where we have sites, we can assign people to those sites, and everything can be done by email. But I think it's designed that if we all pitch in and do this, we will have that information we need to help everybody else. So if your son or daughter, or if you've had some bad times with this disease, let's use that information to help others and maybe yourself for the future. This is just showing the data that goes into our database, all the patient information, all the neurological symptoms, including seizures, headaches, stroke-like episodes. Did you have MRIs, CAT scans? We have a complete battery of questions about any dermatological treatments, such as lasers, ophthalmology, glaucoma. Did you have a blood draw? So this is kind of our dashboard for the database. And again, no patient is identified by name, but simply by an ID number, and we keep any information private. This is just this is from like a year or so ago, just showing you the age distribution of patients who've already enrolled in the study. We have adults, we have kids, people of all ages, boys, girls. We have some who have weakness on one side, actually a majority do. Some are normal, some have delayed development. Again, cognitive dysfunction, behavioral disorders. We get a lot of information, anxiety, have you been bullied or teased at school? Just things that can really be important for helping not just the physical and neurological skin, but also the emotional aspects of this disease, which is very, very challenging. So, I mean, this is just, you can just see, once you start to see things in numbers, they say, wow, wouldn't it be nice to have this and see where do I fit in on this spectrum of these diseases, whether it's headaches or other symptoms. So we also have imaging and so forth. So we've had some challenges with this study. COVID took a big hit on our enrollment when everything kind of shut down for a couple of years. So we're doing a lot of catch up. The NIH money runs out in a couple of years. So we're rapidly, trying to make up for recruitment. And one of our goals at these meetings is to, if anybody's interested, to just get your emails and get in touch with you. We can do the consenting. Again, I'll tell you a little bit more what's involved. Again, it's challenging because this is not a simple study. This is not something where we're just measuring one thing like how many seizures you have. We're measuring so many different things about the eye, the skin, and the brain. It's so comprehensive. So everybody who goes into the study, I mean, 250 doesn't sound like a lot of patients, but it's a lot of work, but really worth it. And it's work for both patients and families as well as our staff. And then we have the challenge that it's a rare disease, so not everybody lives at one of our sites. And we're up and running in full force and eager to recruit folks. We're going to give you opportunities to sign up or let you know if you want to be contacted. And you don't have to travel. We're still working on trying to figure out how to get blood samples electronically. We haven't figured that out yet. We can do everything else electronically, but even if we can't get the blood sample right away, we still want everybody to join the study. And that's kind of the story. And if you have questions, I'll be happy to answer them.